want to first start by telling you a little bit about my childhood. He told you I'm a military brat, moved around quite a bit when I was a kid. My parents formed a strong foundation, but honestly, my parents were extremely cheap, all right? Hi, Mom. Hi, Dad. I think the best thing to say is they're frugal, okay? Both of them grew up extremely poor. They knew the worth of the dollar, so they weren't going to really spend it on something that they thought was frivolous. I don't want you to think that, we were struggling. No, we had a roof over our heads. I had food on the table. I had clothes on my back, but those clothes weren't name brand clothes, right? No cable TV, definitely no J's, no video game systems. But there was one thing that they would spend their last dime on, and that was books. If it had to do with anything with education, they would get that for us. Now, you should know, I'm a physician, and I love what I do, but I actually wasn't that good in school. I just didn't really fit in. I was actually a pretty bad student. So bad that my parents would give my teachers their phone number at the beginning of school year. I would get home, and my parents would know the stupid stuff I had already done in class, right? That's how bad I was. I've been suspended. I've been kicked out of school before, right? So for some of you who are going through that, you still got time. You still got time. But I also still love to read books. And one of my favorite books to read was anything dealing with Sherlock Holmes, which it's interesting because why would a black kid from the South latch on to this 18th, 19th century white detective from Britain? But he was a lot of things that I wanted to be. He was intelligent, he was smart, he was brash, he was eccentric, those kind of things that I really latched onto as a kid. There was two things that I wanted to do when I was a 5-year-old. I wanted to be a Navy fighter pilot, and I wanted to be a doctor. I've worn glasses since I was 4, so Navy fighter pilot was not going to happen, right? And when I found out, I was devastated. So I picked myself up and was like, okay, let me just be a doctor then. I can do this. Now, Sherlock Holmes is actually modeled after a doctor, and I didn't realize this when I started reading him, but as I got a little older, I started reading about the history of Sherlock Holmes. The author of Sherlock Holmes is Arthur Conan Doyle. He actually was a physician too. He was a doctor. He went to medical school, and one of his professors who had this brilliant, keen observational skill set is who he modeled Sherlock Holmes after. His professor could just look at a patient, walk into the room, and he could tell you, just by looking at him, smelling, using all his senses, he could tell you what was ailing the patient, where that patient was from, and all kinds of just interesting facts that he could just tell by looking at him. And that was amazing to me. And I actually use a lot of things that I learned from Sherlock Holmes to teach my med students and my residents. Residents are students who graduated from med school. They're doctors, but they still have to take a couple years to get, like an apprenticeship, to train to get to full-fledged doctors, even though most people still think you're a doctor, so you can still pick up girls when you're a resident. But anyway, so what do I teach them? I teach them that the exam starts as soon as you walk into the room. It doesn't just start when you're interviewing the patient. No, it starts when you walk into the room. What does the room feel like? That's called transference. What does the patient look like? Is the patient hunched over, looking like they're in acute pain? Who's with the patient? What is the patient wearing? What does the room smell like? All these things are very important, right? Because being a physician is a lot like being a detective. You're looking for clues. You're using lab work that you've got from the lab. You're interviewing the patient. You're trying to ask certain questions to get the information that you need to formulate your differential diagnosis. A differential diagnosis is a list of things that you might be causing the patient's ailment, because you need to have a correct differential diagnosis before you can prescribe the correct treatment, right? So one quote that you see a couple times throughout these Sherlock Holmes mysteries is, "It is a capital mistake to theorize before having any evidence. It biases the judgment." So what does that mean for me in medicine? Case in point, I was a medical student in Boston a couple years ago. I was in the emergency room. A young male came in complaining of excruciating back pain. I went in as a med student to do a full history and physical, spent me about 20, 25 minutes, and I came out to present to my chief resident. I started as follows. Patient's a 28-year-old black male presenting with excruciating back pain. He cut me off. My chief resident said, "Stop. He's just here looking for drugs. Get him out of my ER." And I said, whoa, 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 you haven't even let me give you the facts. He said, I don't care about the facts. Get him out of my ER. He's a drug seeker. It started getting heated. The patient had overheard this conversation too. Luckily, at that time, another resident who had sent this patient in to get pain medicine came in, and he was able to talk to my chief resident, and we appropriately treated this patient. Now, some of you have probably seen this in medicine and too, right? With family members or even yourself. People getting stereotyped, people not getting the treatment that they deserve, the right treatment. People look at them maybe that they're a hypochondriac, or because of their race or their social stature, they aren't treated correctly. But this happens in real life too, right? We all like to put people into boxes without knowing the facts of who they are or what they are, their stories, their struggle. And unfortunately, it's going to happen to you if it hasn't already. I know what's happened to me. I know I was told by some teachers that I couldn't be a doctor. So what are you going to do about it? Because it's going to happen, right? This is going to happen, unfortunately. But what are you going to do about it? I'm going to leave you with two things. Number one, I want you to internalize what that feels like when someone stereotypes you, when someone judges you without having the facts. Because the fact of the matter is, we've done it to other people too. I know I have. So you need to remember what that feels like so you don't do it to others. But number two, I'm going to need you to fight against those people who try to create your story, who try to put you into a box without knowing your facts, your truth. Because each and every one of you is a unique individual. And I know that sounds sappy. We always talk, oh, you're little snowflakes. No, you really are. You know why? I know this because I'm an anesthesiologist, right? My job is to put you into a medical coma so someone can do surgery on you. I just don't put your information and press a button and everybody gets the same thing. What I give you is going to be different from what I give you. Even though you might be the same height, same age, same weight, no allergies listed. You know why? Because each and every one of you is physiologically different. I give you medicines, and it might take you 12 hours to wake up. That's called a delayed emergence. Your mom's going to be like, my baby, why does he not wake up? I'm like, it's fine. It'll be all right. You might be like, what, you gave me something? So each and every one of you is totally unique. Each and every one of you has dreams in your heart that you know are real. Some dreams you might not even have told other people. But people are going to challenge you. People are going to try to put you in a box. People are going to try to bend their facts to make judgments about you. So remember what Sherlock Holmes said. It's a capital mistake to theorize without having any evidence. So what are you going to do? Number one, before you make decisions, you're going to get the facts, right? That person might be a jerk. Let them be a jerk. Build those facts up, and then you can get away from them. But don't stereotype them. How many relationships have we already lost out on because we put them into a box? We judged them before finding our facts. But remember, number two, never be afraid of fighting against people who are trying to tell your story, who are ignoring your story even. Always fight. Never be afraid to show them your strength, your knowledge, your courage, your dreams, what is in your heart. Because someone in this room might be the doctor that takes care of me someday and my family. And that makes my heart glad. Because you fought against this society trying to tell your story and judge you without knowing the facts that lie within your heart. Thank you very much.